Well, as you know, the month of February is Black History Month, and this year's theme is Black Health and Wellness. The pandemic has really taken a toll on all of us, but get this. Researchers say more African Americans are taking their own lives because of it. Delia Gonzalez spoke to experts and is here to verify why this is happening and what we can all do about it.
Our sources: the U.S. Department of Health and Human Services, National Association of Mental Illness, American Psychiatric Association, Dr. Paul Nestat, co-director of Johns Hopkins Anxiety Disorder Clinic and the African American Wellness Project.
We need to have an organization that is for us, by us.
We spoke with both Executive Director Monique Lenore and board member Dr. George Woods, a neuropsychiatrist.
Environment trumps genetics.
Dr. Woods says as the country became consumed with COVID-19 and racial injustices, African Americans disproportionately carried the weight of those burdens.
We are the ones that really experience the toxic fumes of racism. We've always been the essential workers without caring for our health because we're seen as being somehow disposable.
So what does the national data tell us? According to the HHS Office of Minority Health, in 2019, suicide was the second leading cause of death among African Americans between 15 and 24 years old. The study also found Black high school-aged girls were 60% more likely to take their own lives than their white classmates.
We are starting to see a decrease in the general suicide rate in America for the first time in 20 years. But we're not seeing that decrease in communities of color.
In fact, Dr. Paul Nestat of Johns Hopkins Medicine said suicides among Black Marylanders doubled from previous years to 94% during COVID's lockdown between March and July 2020. The doctor said during that same time period, white Marylanders had half as many suicides. The doctor's peer-reviewed research was published in the Journal of the American Medical Association back in December 2020.
And that tells us that we're not paying enough attention to specific vulnerability. Access to care is one of the most important things, and it's where there's maybe the most disparities in this country.
A study by the American Psychiatric Association shows about 11% of Black Americans don't have health insurance. And according to this analysis by NAMI, economic disparity, provider bias, inequality of care, and stigma are among contributing factors.
Seeking help has been seen as a sign of weakness, especially among Black men. So what we really would like to first is help to remove that stigma, ensure that African Americans do receive the help that they need.
With your Verify, I'm Delia Gonzalez.